Welcome to Chamber Chat via Zoom. I'm Danielle McFadden, President of the Chamber. I'm so excited to have David Morales here. He is the General Manager of Unicare. You are a new member of the Chamber. Super excited about that. Can you tell us a little bit about Unicare and what you do?
Absolutely. Well, first and foremost, thank you, Danielle, for the invitation. And thank you for what you're doing on behalf of your members and your communities. We're excited to be a member of the Greater Lowell Chamber of Commerce. Unicare is a health benefits company. It offers health insurance and health coverage to state employees, retirees, and employees of municipalities that get their coverage through the GIC, the Group Insurance Commission, or the state of Massachusetts. We've been in business. We've been doing this for over 30 years, very successfully, in a way that protects members and gives them a ton of choice and coverage.
So coronavirus is top of mind with everyone right now.
Yes.
As a health benefits company, how is Unicare responding to this pandemic?
Yeah, great question. Look, Unicare is here for its members, bottom line. What comes first and foremost for us is our members' health and safety. And so we've done many things. The first one is we have pivoted toward a remote structure of working, of caring for our members, and creating health access toward a lot of remote tools. So for example, on the membership side, we have created a lot of access tools like Live Health Online, like Mobile Health, like Firefly. These are all organizations that we've put together and created contracts with to help our members access health benefits, health coverage, health assessments, all remotely. They can literally call Live Health Online and access all the information either on their app or telephonically with an RN or a physician. Same thing with Mobile Health and same thing with Firefly, so that we're giving our members as many options as possible to get access to what their care needs might be wherever they are, whether it's home or somewhere else remotely out of state. So that's one thing for members specifically. For our employees, we've moved all our employees to work remotely from home in a way that's safe with technology, with their laptops, with phones. Their safety is just as important. And then the third thing is for our communities, we're working with key leadership like you to quietly distribute wherever we can resources or help in any way that we can. We're doing this quietly because frankly, it's not about taking credit. It's really about helping our community stay healthy and safe.
Thank you for all that you're doing. It's so amazing how quickly you were able to implement some of these things. And I think one of the positive that's going to come out of this is that we're all now, we've embraced technology. We know how to use it. And I think going forward, there's so many things that are going to be streamlined and so many aspects of our life that are going to just be based more on what's convenient for us.
Yeah, I totally agree with you. I think this is an opportunity for all of us to rethink how we live, how we work, and in the area of healthcare, how we provide healthcare and consume healthcare. Mm-hmm. So we view this at Unicare as a major opportunity. It's interesting, one of the things that folks don't know about Unicare is we are a subsidiary of Anthem Blue Cross Blue Shield. Anthem is the largest Blue Cross Blue Shield plan in the United States. Wow. And we have access to a chassis, very, very large and well-resourced organization that is helping us to right now think really differently about how we're going to service our members post-COVID-19. We need to move quickly. We need to move agile in a way that's agile so that we can meet members where they are. It shouldn't be that the health system stays static. We have to be responsive now, and we have to do things really differently in a way that addresses people's care needs, medical needs, health needs, wherever they live, wherever they work, and that's exciting.
Very exciting how people are going to be able to access, and they already are, their health needs online.
Yes. Yes. Look at us today.
So cool. I know. So we typically have a radio show and a television show, and obviously we're not at the studios. So I said, well, why aren't we doing this via Zoom? So much fun. And it's great being able to see people.
Yeah. Yeah, totally. So this has been very helpful. And there are many other tools. There's Zoom, there's WebEx, et cetera. But it enables us to work without disruption. So it's definitely one of the many tools that we're going to explore more and more as we seek to do things differently.
Although I do say I can't wait to get back to the office.
True enough.
For extroverts, thank goodness for Zoom.
True enough.
I understand it's annual enrollment season for our group insurance commission right now through June 1st. So what sort of features should individuals look for in a health plan?
So again, I want to remind folks that we provide health coverage to state employees, Massachusetts state employees, Massachusetts state retirees, and municipal employees that get their coverage through the Group Insurance Commission. The Group Insurance Commission decided to extend annual enrollment from April 6th to June 1st. So it's a pretty extended window for folks to access health benefits. It's a wonderful decision by the Commission and by the Governor Baker administration. I think there's three things to really think about for members that qualify for health insurance to do the GIC. As it relates to Unicare, my suggestion is three things. The first one is think really deeply about what your healthcare needs are. If you have health conditions that require intense medical care and 24/7 type care, you're going to want to think about a different product. So for example, a Unicare basic product, which covers you anywhere in the world at any time for any service. Your doctor, your physician, your hospital, anywhere. If you're someone who may not need a lot of intense health care and lives in a very targeted community and you don't really travel much, you might want to look at Unicare Community Choice, which includes probably your local hospital, your physicians, your urgent care, your pharmacy at a very lower cost premium. But that's the first thing. What are your real healthcare needs? The second thing I urge people to think about is who is their doctor and which hospital do they usually frequent and whether or not they have children. That's another really important marker for health insurance. And then the third thing is with Unicare, you don't have to worry about your provider or your hospital. We cover them. But what you have to think about is what plan design works best for you. There are three that we offer. There's basic, which is frankly the most robust, but it costs a little bit more because you're buying everything. There's plus, which is a tiered product that tiers hospitals based on cost. And then there's community choice, which excludes certain hospitals that are higher cost, but includes most, if not all, community hospitals in Massachusetts. So I urge people to think about it that way. Whatever works best for you, we have a product that works for the individual's healthcare needs and family needs.
Thank you for joining today.
Danielle, thank you, and thanks for what you're doing. If there's any other information that folks would like to learn more about Unicare, we're here. Visit our website or reach out via email. We're here to serve our members.
Excellent. Thank you so much. And thank you all for tuning into Chamber Chat Zoom today. Check out our website at greaterlowellchamber.org. We have a ton going on and it's open to all businesses and organizations in the community right now because we just know that that's really important to give everybody access to these opportunities during this time. Thank you so much. We have Karen Woodrow and Larry Michael, who are the owners of Visiting Angels in Chelmsford. How are you both?
Great. How are you?
So good. So good to see you.
It's great to see you, Danielle.
Thank goodness for technology, because even though we're not able to actually see each other, I get to catch up with people, which is really important this time, with everything going on.
Yeah.
Yeah, and seeing your smiling face is a great motivator for our day. So I'm glad we're doing this in the morning.
Thank you so much. I appreciate that. So Visiting Angels offers essential services and is open during the Massachusetts stay-at-home order. So how have you been able to provide services during this pandemic?
Well, we have to give all the credit to our team. Our caregivers and our office staff are so truly dedicated and committed. They've continued to demonstrate that dedication. Everyone has been very diligent about practicing good hygiene. And for our part, we've been able to provide protective equipment to our caregivers and financial support to our caregivers so that we can help them through this pandemic.
I'm sure they really appreciate that.
Yeah, it's been difficult to navigate. There's been a lot of questions and a lot of uncertainty, and it's been a little nerve-wracking, but we've been able to navigate through the situation, and our caregivers that don't have as much work, understandably, because some clients are home with their families, things like that, and we've been able to continue to pay them even when they have lost some of the time that they would normally be working.
Who would have thought, what it was, is it a year and a half since you've been the owners?
Yes.
Yeah,
About
so
that?
we started last January with Visiting Angels Chelmsford, but the previous owners had established it 10 years ago. So we had a big 10-year anniversary celebration. We got that in on April 10th. No, not April 10th.
March 10th.
March 10th. So we literally had our huge anniversary party with all of our caregivers to honor them for their 10 years of service when this whole thing came crashing down.
Wow.
So I'm glad that we had a chance to honor them because they are really true heroes during this crisis. We are open and operating because we are an essential service. Seniors are in homes by themselves. They need help. They need companionship. We have one client who I feel like she would just wither up and die from isolation and depression. So like compared to COVID, it's just really nice that our caregivers can go in there and provide conversation and go grocery shopping for them and tidy up their house and just sort of keep their lives as normal as possible. And so when we were included in essential services, it made a big difference for us and our clients and our caregivers who can stay working.
Couple things. One is March 10th seems like 10 years ago.
I bet.
And I think about seniors and what Karen was saying, and those days get really long when you're all alone and nobody comes to visit, and the same old thing is on TV. And like you said, thank God for technology, but human interaction is so important, and it's really nice for our clients that are able to continue to have caregivers come and visit them and spend some time with them for a few hours every day.
What I was going to say is social distancing is something that we hear, I don't know how many times a day, but somebody said to me, you should actually use the phrase physical distancing.
Right.
Because people who tend to feel socially and just isolated, it makes them feel even worse if they keep on hearing social isolation. You can actually still be social during this time and keep a physical distance and, be safe. And to that note, what are some of the things that you're doing to keep seniors safe?
Yeah. So as I mentioned before, we've given our caregivers, they always have gloves in case they need them for any of the care that they're providing. Now is more important. They all are using gloves. We've been able to get masks for them, so they're using that.
Right.
It keeps both them and our seniors safe. And, they know that it's best to stay 6 feet away. You can provide companionship and dialogue and do a lot of things from 6 feet away, prepare meals, some light housekeeping, a lot of the things that our caregivers normally do, they can continue to do.
Mm-hmm.
And then for those seniors that need, help walking or going to the bathroom or those kinds of things, our caregivers know how important it is when they walk in the door, they wash their hands, they have their protective equipment on, and there's a lot that they can do and do it safely.
We also have Visiting Angels University, and it's a training program that all our caregivers go through. And one of the classes that pops to the top of my list during this time is the infectious disease control. So they are well versed in how to prevent the spread of disease, and we are also putting out videos and any kind of training that we can find to reinforce this message on how to keep themselves safe and how to keep the clients safe.
And one of the things I would imagine, people that are either listening or watching would want to know is, well, what happens if somebody has symptoms, either a senior or a caregiver, or if they've been diagnosed. And we don't want our caregivers to feel like they have to go to work because of the financial pressure that they may be under. And so we've told them that if they have symptoms that they need to call us, we will not have them work until things clear up. Either they're tested and it's negative, or if it's positive for 14 days and then they're tested for negative. But we will continue to pay them for their lost hours. So we've tried to remove that financial pressure that might, sometimes when you wake up in the morning and you've got a cold and you think, oh, I can still go to work. Well, this is a situation where we just have to be safe. And so we want to make sure our caregivers don't feel that pressure.
Thank you for doing that. That means a lot to, I'm sure, your families that you're working with, obviously your caregivers and the community as well. That's great.
Oh, it's the most important thing we do is keep people safe.
How have your clients and their families responded to the current situation?
Everybody really understands that safety is the most important thing, that what we're doing is keeping that in mind, and so they trust us. And we understand that each family is unique and they're making the best decisions that they can for them and their family members.
Now I'm going to flip the coin and ask how your caregivers have responded to the current situation.
Our caregivers are really awesome, and they are totally rising to the occasion. You know, it's great for them. There's no traffic. They can get to the clients like in half time. So that's a benefit for them. A lot of our caregivers have full-time jobs in other places. For example, we have a dental hygienist who works a 40-hour work week in a dental office, and unfortunately she's been laid off from that position. And instead of, you know, hiding under a rock at home, she's stepped up and she has taken on more hours than she normally does. And people go into this line of work for a reason. And I think, you know, it's not just the money and earning a living, it's because of the personal satisfaction they get from doing this kind of work. And so our caregivers, you know, they're very driven by that, by helping other people. And in this crisis, they really understand how helpful they're being to keeping the company going, keeping themselves going, to be motivated to get up every morning and go do something, and to really care for their clients. So they've been great. A lot of our caregivers, as Larry mentioned, do have childcare issues, and they're constantly calling us like, I think I have childcare today. I think I can go work. And even though we're paying them for lost hours, you know, if they have childcare issues or COVID related problems, even though they can get paid, they're still doing their best to get out there and work, which is really heartwarming.
So have any of your clients been tested for COVID-19, and have they tested positive?
So some of our clients have been tested. None of them have tested positive.
Great news.
Yeah, that is great news. And, you know, there's other things going around. There's, you know, colds and flu and other things. And so there are some clients that where either family members or facilities are keeping a close eye on them and trying to make the right decision about whether or not they even should be tested, because, you know, the test is not a pleasant experience from what I've read and been told. But yeah, knock on wood, none of our clients have tested positive. And along those lines, we've asked all of our clients and all of our caregivers to certify that they have not been exposed. And if they have potentially been exposed, like I said, you know, we have them sit out for 14 days for the caregivers. We're not equipped to provide care to a client that it has tested positive. And so we would need, you know, family members to step up, or other agencies or facilities that have the equipment to care for somebody that has COVID-19 to provide support to that individual for those 14 days. And then, you know, we ask them questions. You know, this was sort of at the beginning of the pandemic, not now, but have you been on a cruise? Have you traveled? Those kinds of things. Nobody's done any of those things lately. So, but we asked those questions too at the beginning.
That's a really interesting point, because we're, you know, 6 weeks into this now. So at this point, no one got any, if you get it now, you didn't get it on a cruise ship.
Right.
As Larry mentioned, there are other things going around like the flu or just the common cold, and allergy season is coming. And I will say that most of our clients are testing positive for a general malaise, just like a general kind of sad feeling for what's going on in the world. And so I think that we actually had a couple of clients increase hours a little bit because of this sort of, just the atmosphere in the world is not a happy one. And I think everybody is feeling it. And so adding a few more hours with a caregiver, just helps brighten your day.
Absolutely. I was saying to you off air, I think that you guys are going to be even busier after this is all over because people will have been home with their loved ones and they'll say, oh my gosh, we appreciate what you do. Like, that's how I feel for teachers right now. Like, oh my gosh, you are my heroes.
You know, it's interesting. There's always family dynamics. We experience it with our families. I think everybody does, where, you know, a parent treats their adult child still like, you know, the son or daughter that they've always known, whereas, you know, somebody that is not a family relation gets treated a little bit differently. And so that family dynamic can really put some strain on folks when the adult child is the caregiver. And so I think you're right. I think we'll be busy when this is all over, and people do appreciate what our caregivers are doing for their loved ones.
Now, we talked about your clients and being tested for COVID-19. Have any of your caregivers been tested for COVID-19, and has anyone tested positive?
Yes, our caregivers have been tested. We'd like to test them all, just, you know, out of an abundance of caution. But we follow the protocol, and some of our, I think 3 of our caregivers have tested positive. As Karen was mentioning, most of our caregivers, you know, have other jobs as well. And although it's impossible to always figure out exactly where they might have been exposed, we do know that 2 of our caregivers were called by their other employers because a colleague tested positive, and so they had been in close contact, and they told them that they should go get tested, and they did. And so that's what happened there. And then a 3rd person also tested positive. We think it was probably from a family member that had tested positive a few days earlier. And, you know, one of the first things we do is check and see, okay, if somebody tested positive, when were they last with a client? Is there a possibility that there was an exposure to our client? And knock on wood again, in all 3 cases, the last time the caregiver was with a client was, like, in some cases a week or more from when they started to have symptoms and then were tested. But even in those cases, we've then informed the family or the facility or both, depending on the situation, so they can keep an eye on the client, see if they've got any symptoms, and if the situation warrants it, have the client get tested too.
And as Larry mentioned, we would love to test all of our caregivers every day before we send them out. But we've looked into it. Every time we hear that testing is available, we pursue it to see if we can qualify to get our caregivers tested. And we just haven't reached that point. We're not doing it because we don't want to. We're not testing our caregivers because we just can't do it yet.
So you've been really busy, as we've discussed, but what else are you up to? Because I've been seeing your face everywhere, Karen.
Oh, well. So I am doing a television show on Chelmsford Telemedia, and this show is called The Q. Get it? Rhymes with the view.
I love that. That is so cute.
That was Karen's idea.
Oh my gosh, so cute. Good job.
So it's basically like a panel talk show about the Q stands for questions about the quarantine. And it was the brainchild of Lisa Maroney, who is the director of business development for the town of Chelmsford. And she just felt like that the people in the area just are going to have a lot of questions and could use a lot of support during this time. And so how could we come together, gather a panel that can relate relevant information through what everyone's going through at this time? So our last episode, there was a panel of 4 people: Lisa Maroney and Jen Melanson. She is the community services project manager for the town of Chelmsford, and Megan Curran, who is a nutritionist, and me representing Visiting Angels in the senior community. And we represent a panel. And last week we hosted the school people from the town of Chelmsford, and they spoke about how to deal with school children now, how to balance academics, how to balance behavior and mental health. And there was a focus on children with special needs and the challenges that their parents are facing with kids being home without the supports they usually get through school. And so we have a couple of shows scheduled out for the future. Danielle is going to be one of our guests, probably in 2 weeks, I think it is. And we're going to be talking about how people can support small businesses in a time like this when small businesses are really struggling. So it's been a really interesting experience. I'm learning a lot about Chelmsford and a lot about all the different ways that the town of Chelmsford can support its residents.
Amazing. I can't wait to be on, and I love the queue, and Lisa Maroney is fabulous. I just love her.
She really is. It was a great idea, and Chelmsford Telemedia has been super helpful. They're very creative, and you can view the show. It's on Visiting Angels Chelmsford's Facebook page. I'm going to share it with Danielle, so it'll be on the Chamber Facebook page. And if you're just looking for some extra support, some extra ideas on how to get through this time, hopefully the queue can answer your questions.
Well, I just absolutely adore you both. We love working with you. You do such great work in the community. I can't wait till we can see each other in person sometime soon, but this was definitely the next best thing, and I really appreciate you both being on.
Well, thanks for having us. We always enjoy talking with you, Danielle. I'm looking forward to seeing you in person again.
Hopefully sooner than later.
Danielle.
Yes, anytime. And thank you all for tuning into Chamber Chat via Zoom. Check out our website at greaterlowellchamber.org. We have a ton of stuff going on and a lot of great resources, and they're open to anybody in the community. So thank you very much for tuning in. And until next time, we'll see you soon.